Hello YouTube, meet malaria's cousin, Babesia. Hi there, welcome to my channel. My name's Teresa. I post weekly videos like this one, speaking about very specific health issues. Every other Sunday is a video like this that's informational, whereas the Sundays in between will be my personal story related to the specific disease that I am speaking about. If you are interested in learning more about my story and the diseases that I struggle with, please hit the subscribe button down below. I would love to have you hang out with me. Today I am going to be speaking about Babesia or babesiosis. Now I do want to say as a disclaimer before I even get started in this video, I am not a doctor. I am not a medical professional. I have zero training, zero schooling in the medical field at all. I am just someone who has personally dealt with this disease, and I want to share my experience and my research with you all. This is through talking with doctors, talking to other people who have Babesia, as well as doing online research. I have a whole lot of papers here, and I will make sure to cite everything down below from where I got my research. I highly recommend that you dig into this yourself if you think you or someone else may have this disease. Please do talk to your doctor. Do not just take my word for it. Again, I am not a medical professional. I cannot diagnose you. I will not give you any medical suggestions because that is not who I am. I am just here to let you all know about this disease that has majorly affected my life. So Babesia, what is it? Babesia is a malaria-like parasite, also called a protoplasm, that affects your red blood cells. Now, Babesia is very, very common among people with Lyme disease, including myself. I was diagnosed about 1.5 years ago with this disease. A study done in 2015 showed that about 40% of patients with Lyme disease in the United States alone have Babesia. That means out of the 300,000 cases submitted to the CDC every year of Lyme disease, 120,000 people have Babesia as well as Lyme disease. It is actually a lot more prevalent than I believe people realize. I didn't even realize it. Again, I've had Lyme disease. I was diagnosed with Lyme disease when I was 15 years old. I am 30 now. I just found out 1.5 years ago that Babesia was even existed. I didn't even know what it was. The most common way to get Babesia is through the bite of a tick, an Isolades tick, or a black-legged deer tick, or just a deer tick. There is a lot more research coming out now that says there are many more ways to get Lyme disease than just tick bites. There's a lot of other biting insects that can transmit it. But as far as the CDC is concerned, the only biting insect that actually can give you Lyme disease, Babesia, and other co-infections is this deer tick. Now, Babesia has been reported all across North America, Europe, and Asia as well. It is likely it's in other countries, but I haven't seen much research done in, say, like Australia or India or the Middle East. You know, I'm not really sure as far as those countries go how prevalent Babesia is versus the ones I mentioned previously. The first case of Babesia or babesiosis was actually in Nantucket, Massachusetts in 1969. Since then, scientists and doctors are much more aware of this disease and realize that, as I said, it's on a couple different continents. This disease did not become nationally noticeable until 2011, with more than 1,100 cases reported to the CDC. 2 years later, that number had risen to nearly 1,800. So by 2013, which of course was quite a few years ago, there was 1,800 cases of confirmed Babesia in the United States alone. Scientists do believe that Babesia is the #1 protoplasm affecting humans today. There are 3 ways you can get Babesia. That is through the bite of a tick or a biting insect, through a blood transfusion, and through a mother giving it to her unborn child. Basically, if you are pregnant, you can pass it during pregnancy, or even during birth, you can pass Babesia on to your child, which makes this disease quite scary. Now, this disease can range from anywhere from people not even knowing they have it, they have absolutely no symptoms, all the way up to life-threatening. It completely depends on the situation and how your body is, which I will get into in just a moment. So now that you kind of have a background of what this disease is, let me tell you what the symptoms are. As I mentioned before, Babesia is malaria's cousin. Now, I don't know the exact scientific wording to this, but I do know what I was explained by my doctor was the symptoms are pretty much the same, the treatment's the same. It's basically the DNA makeup of the bug that causes malaria and the DNA makeup of the bug that causes Babesia are different. They're similar, but they're not exactly the same. So that's why I say it's kind of a cousin, because it seems to be in the same genus or family as the malaria bug, but it's not malaria. Now that you have a basic understanding of Babesia, babesiosis, let me go ahead and list off symptoms. Now, I have an article here that I found on LymeDisease.org called Touched by Lyme. And in this article, it talks about Lyme disease as well as all the co-infections that come along with it. But this, again, video is specifically about Babesia, so I'm going to be reading some sections off of the Babesia paragraphs. Babesia or Babesia-like organisms primarily affect the brain and the autonomous nervous system, which you might be able to notice by the way I'm having trouble speaking. Some of the Babesia symptoms are starting to show up in me right now. The first words that a patient with active Babesia-like organisms in his body might say is that he can't focus or think. His cognitive functioning is significantly compromised, and his mood is always affected. Both depression and anxiety are very common. A person with Babesia has a lot of emotional upheaval. Fear is a dominant symptom. As you can see, I had trouble reading this. That comes from the cognitive impairment. Now, Babesia is known to affect your autonomic nervous system, which basically is the part of your body that controls all the things we don't think about. Breathing, blinking, digestion, heart rate. All of these things that just automatically happen in your body that you don't have to actively think about is part of your autonomic nervous system. And since Babesia affects this, there are some really serious health conditions that can come along with this disease. Basically, what this means is that the communication between your brain and your body are compromised. So think of it like if you're on a cell phone and you're talking to someone and you're having a really important conversation, but it's staticky, the call keeps dropping, you can only get bits and pieces of the conversation. You're not going to be able to fully understand this person or know what they need you to do because you can't hear them. That's basically the way that your brain and your body works, is there's a disconnect in there somewhere that it gets all out of whack because it's like, oh, I don't know what I'm supposed to be doing, so I'm going to work too much or too little, or, you know, different things like that. So any physical symptoms that come from babesiosis are actually more related to autonomous, I'm just going to say ANS from now on so you guys know what I'm talking about. So physical symptoms of Babesia are more likely caused by your ANS dysfunction than the actual organisms themselves. For instance, Babesia can cause something called postural orthostatic tachycardia syndrome, or better known as POTS. This is where your heart and your blood pressure do not regulate. Usually it means your heart beats way too fast and your blood pressure is way too low. This is actually something I am currently working on getting diagnosed with, as I seem to be having these issues. Some other very common symptoms of Babesia would be shortness of breath, air hunger, where I'm talking about, I'm gonna have it, where you just feel like it's almost an asthma attack, but not quite, because you can still breathe, you can still get air in. It just feels like you can never get enough. So a lot of times this means someone will yawn a lot, sigh a lot, be very tired, because the fact that Babesia affects your red blood cells are what carries oxygen throughout your body. It's very possible that that affects it as well, not just the lung capability. Additional symptoms of Babesia include lots of drenching sweats and chills. And when I say drenching sweats, I mean you are head to toe soaked. Your clothing's wet. If you get it at night, your bed is wet. You have to change your sheets because you wake up and everything is just drenched like you just got out of the shower. So that's what they mean by drenching sweats. Yes, that is very true. I want to read you a little clip from the Touched by Lyme article because it puts to a T what I experienced with Babesia. Additional symptoms of Babesia include lots of drenching sweats and chills, which I just mentioned. Babesia is a relative of the malaria organism and is part protozoan and part bacteria. So as with malaria, people can get terrible chills and lots of sweats and basically feel like they're going crazy. People with Babesia are often quite chilled and can't get warm and will have to take a hot shower or jump in the bathtub to warm up. Another thing that I have found for myself on those days when I feel like no matter how many blankets or layers I have on me, when I'm that cold, if I drink a hot drink like tea, that also helps warm me up. Temperature deregulation is again related to dysfunctional autonomic nervous system. So people either can't get warm or they get too hot, which currently right now I'm feeling the too hot. They turn down the thermostat at night because they're too hot, but then they get too cold while in bed, so turn it back up by a degree. They freeze when going to bed, throw the covers on, then in the middle of the night they're boiling hot, throw the covers off, and drench their own bedcloth in sweat, which is something I've been experiencing the past few nights, and it is not a fun experience. Some more symptoms of Babesia include insomnia, blurred vision, which for me is like, basically I feel like I have a film over my eyes. Bowel mobility issues, again the ANS, it affects your digestive system. So mostly you end up with constipation. You can have diarrhea, but it's more common to have constipation. Bladder difficulties, as in you will have trouble starting a stream, and then sometimes you may even have incontinence as well. Muscle aches, chest pain, hip pain, shortness of breath or air hunger as mentioned, fatigue, headache. A dominant Babesia infection can also affect your wrists, hands, ankles, and feet. These areas can be painful, numb, or experience temperature extremes. As I mentioned, Babesia can be so mild that you don't even notice any symptoms at all the way up to life-threatening. It can be life-threatening for people who are immunocompromised, basically have weak immune systems, the elderly or the very young, and people without a spleen. Babesia can also cause very low blood pressure, liver problems, severe hemolytic anemia, which is where your red blood cells break down, and kidney failure. Again, you know, I think some of these things, they sound scary, but it's in the extreme cases. So, you know, I am not right now in any danger of kidney failure because I have my spleen and I am immunocompromised, and my doctors are keeping a close eye on things. So I know some of these things can be like, oh my gosh, that's really scary when you hear life-threatening, but just know that just because you have Babesia doesn't mean that your life is automatically in jeopardy, but it does mean that you need to take it very seriously and make sure you go to your doctor right away. Now, Babesia is diagnosed differently than, say, Lyme disease would be diagnosed. So you can do a blood test for Babesia, but this method is only reliable within the first 2 weeks of infection. Right now, most tests only test for 2 strains of Babesia. Unfortunately, there are a lot more than 2 strains. You may have a negative test, but that doesn't mean you don't have it. It just means you don't have the strain they tested for. The most common ways to test for Babesia is something called a PCR, which is polymerase chain reaction test, and that looks for Babesia within your blood. The other way is a FISH test, which is fluorescent in situ hybridization. Probably totally butchered that. This can detect the ribosomal RNA of Babesia in thin blood smears, so basically a blood smear. You can also have a lab test for antibodies within your blood. It may be necessary to run several different types of tests, and just because your test comes back negative, unfortunately, that is not a dedicated no, you don't have it. You may still have Babesia even if you test negative for it, which is very unfortunate. So now that we know what it is, what it causes, and how to test for it, how do we treat this? There are a couple different ways one can go about treating Babesia, and most commonly is treating it the same way that you would treat malaria. So anti-malarial drugs would be used in treating Babesia. According to the CDC, treatment does depend on the individual, so it's very customized to you and your situation. According to the CDC, babesiosis usually is treated for at least 7 to 10 days with a combination of 2 prescription medications, either atroquine plus erythromycin or clindamycin plus chlorine. That combination is more standard for the severely ill patients. I do know that you can treat it homeopathically with herbs and tinctures as well. That is actually the majority of how I'm treating. I am treating with some prescription medication, but I'm personally choosing to treat more of a homeopathic remedy. There are some great resources out there on what to take. I believe it's Dr. Brunner, I think is how you pronounce his name. It has a whole list of protocols for Babesia. I will go ahead and link those below because I do not know them off the top of my head. Now, is Babesia even preventable? Is there any way to not get this disease to begin with? Yes, it is preventable, but I would say that it's not maybe as easy as one would think to stay away from this disease. What the CDC recommends is to stay away from areas that are tick infested. Because ticks are a main transmitter of this disease, the CDC does recommend that you are to either completely avoid areas like wooded, bushy, wet areas that may have ticks, or if you need to be in these areas for whatever reason, you take precautions as in long sleeves, long pants, long socks, pants tucked into your socks, which I know it's almost impractical for some people to live this way. And they also recommend that you do a thorough tick check every single day before you go into your house on yourself, your clothes, your personal body, and that includes places like that you may not think to look, like behind the knees, inside your ears, your groin area, back of the neck, like right here at the neck hairline. Make sure you check your pets, and make sure you definitely check your clothes as well, because the problem is the main ticks that will carry this disease are nymphs, which are very, very tiny little baby ticks about the size of a poppy seed. So it is very likely that you may miss seeing this animal or this bug on your body. There are different things you can use, different chemicals and sprays that you can put on your skin, put on your clothes that will help prevent ticks as well. But again, the number one way to not get bit by a tick is to not go into areas where ticks are, which is a very, very hard thing to do, especially if you live where I do in the Pacific Northwest. They're kind of everywhere. Now, unfortunately, another very high way to get Babesia is actually through contaminated blood transfusions. I know that may sound very frightening to some of you, but unfortunately, the truth is because it affects your red blood cells, if you are infected and you donate blood, it can go into the blood, and then when it's transmitted or transfused into the recipient, they may contact this disease. I do have some information about this if you all are interested. I'm just going to kind of go over a few quick points, and again, I will link this article below. This is from LymeDisease.org, and it's Lyme Science, Babesia, and the Blood Supply. It says in December of 2016, the American Red Cross published the results of a 2-year study into the U.S. blood supply. They were specifically looking for infectious parasite known as Babesia in donated blood supply. They found it in 335 of the samples tested. Now, the CDC has known since 1979 that Babesia causes transfusion-transmitted infection in the United States. But why don't we hear about it? That's a whole conspiracy story for another video. The FDA estimates that that 11% of transfusion-related deaths are caused by microbial contaminated blood, with up to 38% of those being from Babesia. Now, unfortunately, the American Red Cross does not have any way of screening for Babesia currently. I do not know if this is something that other countries, Europe, Asia, Australia, if you guys screen or not for your blood drives, but here in America, they don't. They don't even actually screen for Lyme disease, which is another really scary thing because Lyme is transmitted through blood as well. Most people are unaware that they have Babesia if they don't show symptoms or if they've been improperly diagnosed or improperly treated, so they go to give blood and therefore that gets into the system and you have a whole mess. And actually, former First Lady of New Jersey, Jean Bryan, died of babesiosis in August of 2015, which was contacted through a blood transfusion. Now, the American Red Cross, when screening for potential blood donors, they do say if you have been diagnosed with Codgen's disease, babesiosis, or leishmaniasis, I don't know what that is, you are not eligible to donate. But if you don't know, how are you supposed to say, oh, I'm not eligible? Now, according to this article, Babesia and the blood supply, the CDC has known for years that relatively healthy individuals infected with Babesia can unknowingly donate contaminated blood. However, it wasn't until 2011 that the CDC set a standard for surveillance and made babesiosis a reportable illness. So I believe I mentioned earlier the CDC has known about Lyme disease or Babesia since like the 60s. It wasn't until 2011 that they actually said, oh, hey, by the way, maybe we should check this out. So, oh, it's a big mess, guys. And unfortunately, only 31 states here in America actually have a system implemented for reporting Babesia. So in 2012 to 2014, the American Red Cross teamed up with Imogen Inc. to investigate the blood supply from 4 different states for the presence of Babesia microti. They screened 89,153 blood donation samples from Connecticut, Massachusetts, Minnesota, and Wisconsin. They found that 335 donations were infected with Babesia. Now, I believe I mentioned there are other strains of Babesia. There are 5 currently known to affect humans, but here in America at least, the CDC only tests for the one. Now, researchers were able to confirm in laboratory that Babesia contaminated blood resulted in positive transmission 50% of the time in healthy animals. Unfortunately, most people who need blood transfusions are sick. So if 50% of healthy animals can get this disease, it's quite scary to think of how many of people who are receiving blood transfusions may actually be at risk for getting Babesia. Now, I know these numbers are quite scary and you might be thinking, oh my gosh, I can never get a blood transfusion because what if it's infected and I'm gonna have this and then it's gonna make my life horrible and I might die. Yes, I can't say that's not true, but there are many things that we can do as a public to educate ourselves and be aware of these risks that are out there in the world. Again, as I said, protecting yourselves from ticks is a huge one. So I'm going to read you a little bit more of this article that basically says where do we go from here, because I know that it can be quite scary hearing these numbers. So this says, with Lyme disease being reported in nearly half of all US counties, with Babesia following a similar pattern, the best thing for patients would be a universal blood screening for all tick-borne illnesses. Because the universal test has not been developed, a reasonable starting point would be to begin a nationwide year-round antibody screening for Babesia as recommended by the FDA in 2015. There are a few states, including New York and Rhode Island, that are trying to implement a screening on their blood for Babesia, but currently nothing has been really widespread. So it's very important that us as the public are educated in this and need to talk to our doctors, talk to our government and say, hey, We need to change. We need screening. I mean, if nothing else, if they can at least screen the blood so that someone who is ill is not going to have a life-saving transfusion only to end up with this horrible disease, possibly killing them. Oh, okay guys, that is all I have to say about the horrible disease, babesiosis. I hope that you enjoyed this video, you got some good information about it. Again, as previously said, I am not a doctor, I am not a medical professional. Everything that I have told you today, I will be linking below. All my resources and other stuff just came from talking with doctors and personal experience and that sort of thing. If you are interested in hearing my personal story with this disease, how it affects me, how I treat, how I got diagnosed and all that, make sure to subscribe because next week I will be posting that video. I do also post some fun videos on Wednesday as well, like tag videos and just some other fun, not so serious stuff. So if you would like to check that out too, make sure to hit the subscribe button. If you would like this video, please do give it a thumbs up. Let me know how I did. I am new to making these videos, but I'm really wanting to get into this and make sure that I can give you guys the best, well-rounded information about these diseases that I and many, many other people struggle with. If you have any questions, comments, advice, anything, that's nice, please do leave it in the comments below. I very much look forward to talking with you, and I will see you all next time. Bye.